These two children in Nigeria's Borno state are reportedly paralyzed after being diagnosed with polio. The World Health Organization says these are the first cases reported in the country in 2 years. Nigerian government officials and aid agencies are conducting nationwide immunization campaigns and strengthening early detection systems. Pakistan and Afghanistan have also reported polio infections this year, with 21 cases to date. Polio is caused by a virus and is highly infectious. It affects the nervous system and can cause irreversible paralysis. Our CCTV Sophia Dengo is standing by with more on this. She joins us live now from Abuja. Sophia, could these cases be as a result of overcrowding in displacement camps brought on by the Boko Haram insurgency?
Well, Panina, the repercussions of the fighting with Boko Haram amongst displaced people has taken a new dimension, with the Nigerian government and the World Health Organization confirming those 2 cases of polio. And really what we are learning is that the cases came from Goza and Jeje. These are 2 local government areas outside of Maiduguri, which is the capital of Borno, where the fiercest fighting has been going on and, of course, has the most number of displaced people here in Nigeria. And, you know, these cases really prove that, you know, these inaccessible towns or areas that have not been reached by first aid workers, or in any case, the Nigerian you know, emergency management agency that is responsible for providing some kind of frontline medical services, really proves how difficult it is to ascertain what is happening in Borno. And the United Nations, you know, aiding the Nigerian government in trying to reach these affected areas. And it is expected to have more cases of polio registered in the northeast. Penina.
Yeah, let's talk a little bit more, Sophia, on those areas that you touched on that are extremely difficult to access due to insecurity. So then how does the government plan to conduct successfully immunization campaigns there?
Well, you know, Penina, Nigeria had registered nearly a year of no reported polio cases here, what they called a polio-free environment. And of course, that has now suffered a setback with these 2 reported cases, and probably cases that will, you know, surface as a result of, you know, these findings. The focus now is for the Nigerian government to address these key areas. But what we know now is that the target is 1 million children in 4 local government areas in Borno. And there's also a strategy to expand in 3 other states that surround Borno, really to reach almost 11 million children in the fight against polio. But as of now, these 2 cases have reopened, you know, the idea that the persons in the northeast have suffered in many ways, you know, due to the displacement that has taken place because of Boko Haram.
All right, Sophia, appreciate very much. Thanks very much for joining us, Sophia Dengo, live for us in Abuja. We're also joined on the phone by Oliver Rosenbach, Communications Officer for the World Health Organization. Oliver, what are the main challenges of stopping the spread of polio in Borno State?
I think what this shows is how dangerous this virus is, and how persistently it is trying to survive. Over the past few years, authorities across Nigeria, and in fact across the region, have been working extremely hard to make sure that all children are vaccinated against this terrible disease. And there's been tremendous strides made against it. If you think that back in 2012, Nigeria was the global epicenter of polio disease, and now we've got really only very isolated cases still. But this is a virus that finds every unvaccinated child. And it doesn't care if the child is not vaccinated because of lack of infrastructure, or because of community resistance, or because of inaccessibility or insecurity, or whatever the reason. It is just very, very good at finding unvaccinated children. So the aim has to be to make sure that all children are vaccinated. In an environment such as Borno, you have, of course, inaccessible areas, or areas which are affected by insecurities. So the key will be to work with local communities, local community leaders, to make sure that local vaccinators can be equipped with a vaccine, and make sure that children are vaccinated. This is for sure more challenging in such an environment, but we've seen in many other areas with similar.
Sorry, we seem to have lost that line there, but that's Oliver Rosenbar, the communications officer for the World Health Organization, speaking to us live from Geneva.